This is Kenya News Update today. Imagine rushing your loved one to the hospital after a hit and run, only to be turned away. Not once, not twice, but 3 times, and they die. This is Ghana's no-bed syndrome, and a top lawmaker is now telling families to sue. Coming up, you'll discover the shocking breakdown in emergency care and the multi-billion SAIDI plan to fix it. Meet Dr. Mark Kurt Nawaane. He's the chairman of Parliament's Health Committee. He's seen the reports, he's heard the stories. And he's furious. His call to action is direct and unprecedented. He's urging families who lose relatives to this crisis to take health facilities to court. But here's the twist. This isn't just about one tragic case. It's a systemic failure where hospitals operate like isolated islands, leaving patients to die in transit. For years, Ghanaians have known the term no bed. It's a death sentence whispered in emergency rooms. A victim is bleeding out and the response is a shrug, no bed. Move along, Dr. Nawaane struggles to understand why. Standard medical practice is clear, stabilize first, then refer, but that's not happening. He believes the core of the problem is a catastrophic lack of communication. In Accra, major specialist hospitals sit close together, yet they don't talk. If one has no bed, they don't direct you to another that does. Every facility is an island. Patients become ping-pong balls in a fatal game. And then something shocking happened. A new fund was approved. A massive 2.9 billion Ghana cedis for the Ghana Medical Trust Fund. This is the potential game changer. But where is all that money going? Here's the breakdown that will blow your mind. 1.6 billion cedis is just to pay outstanding claims to health providers. Nearly a billion cedis, 975 million to be exact, is for infrastructure and equipment. And a smaller but critical 44.2 million cedis is for training medical specialists. Dr. Nawaane notes that many regional hospitals lack basic MRI and CT scan machines. They're accredited but can't function. The fund aims to retool them, to take pressure off the major centers. But here's what nobody's talking about. Will the money fix the communication? A networked system for real-time bed availability is what's desperately needed. Without that, the new machines are just expensive decorations. The implications are massive. On one side, you have a push for legal accountability. Sue the hospitals. On the other, a huge financial injection to upgrade the system. Some say justice through the courts is the only way to force change. Others say you can't sue a broken system into working. You must rebuild it. This controversy leaves one burning question. If a patient is turned away from 3 hospitals and dies, who is truly responsible? The doctor at the gate, the hospital administrator, or the entire health system that allowed this to happen for years? Do you think families should sue hospitals over no-bed syndrome? Or is the new billion SAIDI fund the real solution? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news from across Africa.